Well, good afternoon, everyone. We welcome you to our virtual town event here on Facebook Live. We are actually coming from the Topeka Coleman O'Neill VA Medical Center here in Topeka, Kansas. I'm Rudy Klopfer, the Director CEO of the VA Eastern Kansas Healthcare System. I'm grateful that you're joining us here today so that we can share some important information and make sure that we are speaking to our veterans, our community, and building that partnership which we have always had. Again, I'm Rudy Klopfer. I've been the director here for 9 years and I'm excited to continue to serve our veterans here in Eastern Kansas. Today I have two of my executive leadership team members with me at the table, and you'll get to hear them. I have my Chief of Staff on my right, Dr. Michael Leeson, and on my left, A.J. Mooney, who's my Acting Associate Director. We want you to be able to ask questions, so go ahead and put them into the comment section and the questions so that we can be able to answer them after we give some remarks. And also check for some additional items that we may post in there during this virtual event in the comment section that you can gather more information there. So I want to share with you, and I think you all know, one of our statements that we make as we serve veterans is that every day is Veterans Day for us here in VA Eastern Kansas. We look forward in just a couple of weeks to have Veterans Day officially, but every day is Veterans Day for us. And over the past several weeks and coming, there's been some events that we've been able to recognize many of our veterans. As you know, on Veterans Day, there's a couple of Veterans Day parades. There will be one in Topeka and one in Leavenworth, and the one in Leavenworth is 102 years running. So what an awesome time. Also this past several weeks, we've had the Armed Forces Rodeo Association in Topeka, again, to recognize those veterans who have done so much for us as they take a part of the rodeo. And I was able to participate and shake a lot of veterans' hands there and thank them for their service. Now, speaking out of hundreds, past couple of weeks we've been able to recognize a 103-year-old female veteran here in our community living center in Topeka, and a 100-year-old male veteran who lives in Platte City, Missouri, both who received care with us. I've had the opportunity to be there and to thank them and to talk with their families and understand the sacrifices that they gave for us many years ago, but are continuing to do so much even today. And this fine 100-year-old veteran, I know him as he lives in the community which I live in. And I've been over to the house which he lives and had the chance to be able to talk with him. And he shared some of those stories as he served in the Army and what awesome stories they are. And it allowed me to actually share some stories of my own family and my father who served in the Army as well. And so, we're ever grateful for the service that each of you have given us and given us the sacrifice so much so that we have the benefits of today. Today I actually was shadowing some of my staff in the caregiver support program. And one of my staff members was going through an assessment with a couple here in our area. And what an amazing story that this veteran and his caregiver was able to share and that I could hear, and the struggles that they go through, but the support that they receive from the VA, but also from the community and from wonderful caregivers. So, that's so important to us as we remember why we are here as VA Eastern Kansas staff members and taking care of you and taking care of our veterans. That is why we do it every single day. So I appreciate that opportunity. And one other thing, in this coming weekend, there's another recognition of a 107-year-old veteran and a 103-year-old veteran this weekend out in Olathe, Kansas. There's going to be World War II planes fly over. We've had the Combat Veterans Motorcycle Association who also do drive-by parades and thank our veterans. Amazing opportunities for us to say thank you for those who have done so much for us. And so I want to say to you, thank you Thank you for your service. I know you may hear that a lot, but we appreciate what you have done and also appreciate the opportunity that we have to now serve you within the VA. Let me share with you some of our foundational pillars so you know who we are and what we focus on. Quality and safety is paramount for us. Access to care. We want to make sure that you do have access to the care that you need. Veteran experience. As you come to any one of our hospital campuses or any of our clinics, we want you to have an experience that you can say it was of high quality, it was important for us, and we want to come back and we want to tell our veteran friends about the care received. And if we don't do that, we want you to give us that feedback as well. Employee engagement. Our employees are critical. We have close to 2,000 employees. Engaging them in your care and hearing from them is important to us. And finally, something that we have to watch is our financial stewardship. We receive taxpayer dollars to be able to provide this care. We've got to be good stewards of those funds and stretch them as far as we can. Let me share with you some of improvements that we have made over this past year. We've made much progress in the goals that we had set. We have really sought to bring more veterans to care here in eastern Kansas that may have not received care before. We stood up a campaign called I Found One, and I want to let you know that we have increased over 3% from previous years the number of veterans that we serve. And part of this is because of this campaign. So I want to thank you for inviting your veteran friends and also for our staff who've also went and talked with their veterans who may have not received care from us to come out and receive care. We are taking care of more than 39,000 veterans every year, and that's important to us. We also want to let you know that we have access to primary care, behavioral health, and specialty care falls below 25 days if you need that service. Now, if it's an emergent service, we're going to get you in and we can see you. But for a routine exam, again, in any one of those services, we can get you in within 25 days. And I'll let you know as we compare some of the data to the community, that's much faster than what the community. But we're continuing grateful to be able to work with them as well. We continue to utilize VA Video Connect virtual appointments. During this COVID, we've been able to stand up a lot of new processes to allow you to stay at home, still receive the care that you need. Now, staying at home, if it's clinically appropriate, we are open and we are seeing a lot of our veterans come into our hospital campuses and clinics to be able to be seen. And we want to do that one. But there are other means through this virtual method that allows us to meet your needs while you're at home or wherever you may be. We have opened a new emergency department here in Topeka, and we look forward in this coming year to complete phase 2. And that will allow us to have more space and support the veterans who need that care during the day, but also during the nighttime when our main hospital may not be available or all those services. And we also opened a new GI space here in Topeka this year, which will just expand the services that we have available to you. Some of the core services that we have and that we focus on, and you've heard from us beforehand, high reliable organization. It really focuses on zero harm and a just culture where our staff can speak up when we may not be meeting your needs or they may see something that's of concern patient safety-wise. We want our staff to speak up, and that just culture is part of it. But zero harm is what we're striving for, and so we've put a lot of emphasis on that high reliable principles, and you may be seeing some of that as you come see us. Second one is implementing whole health. The whole health reaches both our veterans in their clinics, but also our staff. And so we have several initiatives out there to increase whole health to meet your needs and support your family as well. Primary care, that's a critical core service. Behavioral health, geriatrics extended care, and surgery. And I'll talk a little bit about, as we look forward to this coming year and in the next couple years, what we're doing to expand and focus those needs on. One of those is oncology care. We're looking to increase the space, and we're hiring a full-time provider to be able to meet that needs. We've done a great job heretofore, but we look for additional opportunities, and we're working with Kansas City VA to be able to enhance that as well. Ophthalmology or cataract services, both in Topeka and Leavenworth. We're recruiting some staff to be able to extend those services. We have optometry, but we want to know that there's some opportunity that we can take care of you here in eastern Kansas. And so we're focusing some of our efforts there in ophthalmology care. Orthopedic care, and we're in recruitment for an orthopedic surgeon right now. Beginning in December, we're going to be opening a PET CT scan right here in Topeka. It'll be the first time that we've had that in our eastern Kansas healthcare system, so we're excited. We're working through those processes now, but soon you'll be receiving that care right here in Topeka. Dermatology, we're also hiring and recruiting for a dermatologist so that we can meet the needs of our veterans, and that is here in Topeka. And finally, we are in the middle of some construction for some new community living center beds, which will help us out, as that is a real need for us. And also standing up a Geri-Pact. Geri-Pact is a primary care specifically for our geriatric patients. We have wonderful providers within geriatrics that will meet your needs just wonderfully. So we're excited to have that construction done within the next 6 to 12 months. Finally, we do have some changes coming within our clinics, outlying clinics and rural clinics. First of all, we are moving one of our clinics in the Wyandotte County area closer to 435 and the Legends, those who know that area in eastern Kansas. It's going to be our Kansas City, Kansas VA clinic. We anticipate we will start seeing patients there in early January. A lot of communication has already gone out to those veterans who are receiving care at the Wyandotte clinic into this new clinic. And we're excited for that. We'll have an open house and be able to share this wonderful opportunity with you. Within that clinic, we are going to be bringing some additional services. Physical therapy, as well as looking for chiropractic care and other specialty services, not just at this clinic, but at other clinics as well. We are taking some specialty services out to the clinic so you don't have to travel into Leavenworth or Topeka if you live a little further out. And so we have some strategic planning purposes right now to be able to get those services out there. We're hiring some additional physical therapists as well as chiropractors to be able to meet those needs. We are right now in the planning purposes, and actually even more than that, of looking for space with contracting for a new St. Joseph, Missouri clinic, as we are growing and we want to take some more services out there. So that's happening right now. We'll be combining the clinics in southeast Kansas to a full-time clinic. We anticipate that will be finished within the next 1.5 to 2 years, maybe a little bit beyond that as well. And then finally, we are also looking some additional modifications at the current Junction City clinic to increase physical therapy there and look at some other specialty services. So a lot of things are happening so that we can meet your needs, and we really appreciate your feedback as we hear from you to be able to make those changes from now and going into the future. So just wanted to give you a little information of where we are today, where we're going, and would appreciate your feedback as well. Again, let me turn some time over to Dr. Leeson, our Chief of Staff, to share some information.
Well, thank you, Mr. Clofer. It's great to hear what you have explained in the summary you've given. A lot of our team here at EK knows that my grandfather was a World War II vet and really was my biggest role model growing up. And he's unfortunately not with us anymore, but I do think he'd be really excited to hear what you had to say, and I think he would give it the nod of approval. So that's a big motivator for me. Well, welcome everybody. I appreciate you being here. I want to take a little time to kind of cover some of the ground that we have covered at Eastern Kansas since the last time we did one of these Facebook Live presentations. I think that was about the time we were rolling out our COVID vaccination. So, a lot of territory to cover there. If you are interested in seeing kind of a graphic representation of where we've been in Kansas with our COVID numbers, the Kansas Department of Health and Environment, or KDHE, has a really nice website that shows a graphical representation. I think if you just search KDHE and COVID-19, you'll be able to find that. Looking at that website, you know, the COVID-19, even though it was identified in 2019, really we didn't see significant cases in Kansas until the March, April 2020 timeframe. And that's really pretty much in line with what we saw at Eastern Kansas. Within the state as a whole, the COVID cases really peaked in December of 2020. Again, that pretty well parallels what we have seen in Eastern Kansas. And then numbers were extremely low through May, June, July, and then started to creep up again, where we had another peak during the summer that was really driven by the Delta variant. Along the way with that, you know, during that December peak and those months that were sort of on the shoulders either side of that, our systems were very much stressed. We certainly were able to keep up with the demand, but we did need to pause some of our less critical services so that we could redirect staff to caring for patients with COVID and standing up additional space for isolation rooms to treat COVID. And then as numbers decreased, we were able to stand some of those things back down. And we've continued to be flexible. So when we had the Delta wave come through, we did need to do a little bit of juggling in terms of how we staffed our units to make sure we could continue to meet that demand. Now, in Kansas as a whole, that second wave, or the Delta wave, really peaked last month. And within our catchment areas, we saw pretty similar dynamics. So for the Topeka facility and our CBOCs that are associated with Topeka, really Shawnee County was the county that we saw the most activity of concern. And that Delta wave, or that second peak, really peaked out in August of this year. So we're on the downslide from that. For the Leavenworth facility and the CBOCs that are affiliated with that, Wyandotte County was probably the area of the most activity, and that second wave really peaked there also in August. You know, since that main facility's in Leavenworth, we track Leavenworth County pretty closely, and that one peaked there in kind of the August to early September timeframe of this past year. So we're back down from the numbers we were seeing during that second peak. We are not back down to the numbers that we had been in June, July, that sort of thing. So that tells us we need to continue to task this. We need to continue to stay alert. And of course, the concern that we have is that as we go into the winter months, we could see an increase in COVID cases. We know that coronaviruses tend to transmit better in cold weather. You know, if you think about how your nose kind of gets dry and the membranes get cracked, it's a little easier for viruses to take hold. In the winter, we tend to spend more time indoors where there's not as much air exchange, and so it's easier to transmit infections that way. And then the other thing that we probably need to think about as we're going into this winter is immunity. So coronaviruses in humans don't tend to build long-lasting lifetime immunity, and our vaccinations are probably starting to wane a little bit as we're going to go into the winter. Now there are a number of things that I think position us well for the winter too. We're thinking that Kansas is probably on the precipice of herd immunity. We're around 50% vaccination rates for the state as a whole. And when you add on to that the number of people who probably have natural immunity because they were infected, we're probably getting pretty close to where herd immunity would be. And even though that vaccination immunity wanes, we probably still have a really good amount of immunity. Obviously, people who are eligible for vaccine who haven't received it, if they were to receive it, that would help us going into the winter. And then we have booster vaccinations that we're rolling out for COVID-19, which we also anticipate will help us to limit any winter surge. I think that's a good transition to talk a little bit about the vaccines and the boosters and the waning of immunity, so people can kind of understand and think about that when they're considering if they would want to get a booster. This is really the first coronavirus that we have a huge amount of experience in humans with vaccinations. There's been work done in the animal fields with coronaviruses that cause problems in agriculture, but this is really the first time we've had mass scale human immunizations. And so we have incredibly good data on the safety of those vaccines, but since that whole program just started really in December of 2020, we don't have even a full year of data to know how long that immunity lasts. And you know, the studies that were done early on showed that during the first 4 months that the vaccine was available, it was about 90% effective in preventing both a symptomatic case as well as preventing those asymptomatic cases where people are infected, but it's so mild they wouldn't know if they didn't get tested. The following 4 months, so that first 4 months being sort of, let's say, January through April, so then the next 4 months, say May onward, what we saw then was that there's about a 66% overall effectiveness of the vaccine. So going down from 90% to about 66%. Most of those, what we call breakthrough infections in vaccinated people, were either mild or asymptomatic. So, you know, less concern there, but those are sort of a reservoir to continue to transmit the infection and continue the pandemic progressing. You know, that second 4-month window, a couple things that we probably saw happening. The Delta variant was really coming up at that point, and Delta is one of those that tends to have a few tricks to get around our immune system. So some of that decrease in the effectiveness of the vaccines was probably due to the Delta. It looks like in the literature, though, the majority of that decrease was probably just the natural effect of the vaccine immunity kind of waning over time. You know, we get a flu vaccine every year because the immunity is not permanent, and so the idea would be the same here. You know, when we hear 66% overall effectiveness, that's a little bit on the scary side, but when you look at other studies looking at similar time frame, but looking at severity of illness rather than just infection or no infection, those studies have shown that the infection protection is probably like 4.9-fold. So unvaccinated individuals in that later time frame were probably about 4.9 times more likely to be infected than a vaccinated individual. So that's good. It's not great. But when you look at people who got sick enough to require hospitalization in that later time frame, it was about 29 times higher in unvaccinated people than in vaccinated individuals. And sort of to then, you know, follow on with that, there was a study with one of the two main vaccines that we're using, the Pfizer vaccine, and you'd kind of expect the Moderna vaccine to follow suit. They looked at the first 6 months and they saw that the actual protection from any severity of infection went from about 90% to about 50% over 6 months. But then they also at that same time looked at the protection from hospitalization, and it was very high at the beginning of the trial and stayed very high for the entire 6 months. So, you know, the study didn't go on beyond 6 months, but at least until that 6 months, it was still showing very robust protection. With the recognition that those antibody levels are dropping during that time frame, there have been studies looking at booster doses with either Pfizer or Moderna, and those studies have pretty conclusively shown that that booster will give us antibody levels that are even higher than what we had after the first few doses, the first 2 doses. So, you know, really probably considering that information, thinking about what we may have coming for us in the winter, you know, still an eye toward ending this pandemic. That's likely what influenced the FDA and the CDC to approve boosters initially for Pfizer and then for Moderna and now for the Janssen product as well. And so all of them have been approved for boosters. The Pfizer and Moderna vaccines, if those are the ones that an individual received, those were the 2-dose vaccines, they're eligible for a booster 6 months after their second dose if they're age 65 or over, or if they're age 18 and above but living or working in a setting that places them at risk for infection, or if they're 18 or above and have medical conditions that would place them at a higher risk if they got COVID. And really that medical condition definition is pretty broad. So if anybody thinks they might be in that category, I would say just have a conversation for sure with your primary care doc. Now with the Janssen product, and Janssen's affiliated with Johnson & Johnson, so you may hear either. That was the single dose vaccine. It looked like it may have had a little bit less effectiveness than some of the others, and so that may be the reason that it's been approved for everyone 18 and over to have a booster if that's what they received, and it's 2 months after their initial dose. We have some information out there that it's okay to mix and match the different versions. So if somebody got Pfizer or Moderna as their primary series, it's okay to switch to the other for the booster. Also that Janssen product, it can be mixed and matched in there as well. There's no official recommendation on whether you should stick with the one you had or switch to a different one, and that's probably a good conversation to have with primary care also. Because these are now out and available and we're starting that process, you may have already received a phone call from us. We're doing a series of automated calls to everyone who's now eligible for a booster. For us, since the majority of our individuals receive Pfizer or Moderna, that means they'd be eligible 6 months after their second dose if they meet the criteria. And so that's the group that our calls are initially targeting. We're looking at that 6-month window. If you have gotten one of those calls and would like to schedule and haven't done that yet, or if you think you're eligible and you haven't gotten a booster call, I would say give our centralized scheduling unit a call and they'll be able to get you taken care of. I'll give that number now, and if one of my friends here reminds me later, we'll say it again. It's 1-800-574-8387 and then extension 54453. So again, 1-800-574-8387, extension 54453, and they'll be able to get you scheduled for the booster. Now, if we have anybody listening who hasn't gotten the initial COVID vaccine and would like to get that, we have a walk-in clinic that you can come to. That's Tuesdays and Thursdays from 8 a.m. to 3 p.m. On the Topeka campus, that's in Building 24. On the Leavenworth campus, that's in the contracting building that's probably better known as the old Walmart. So you can go to either of those as a walk-in to get the initial vaccine. If you want to get scheduled for a booster, that centralized scheduling phone number. I think the other thing that we probably want to talk about at this point in the year is the flu season or influenza. And we're definitely into that now. Last year was an incredibly light season for flu, and probably all the things we were doing to protect us from COVID, the distancing, the masking, the avoiding crowds, those are all great things to prevent influenza and might have contributed to us having such a low number of cases. There's a little bit of concern out there in the scientific world that because we didn't see much flu last year, we probably didn't sort of trigger our immune systems, and so this could potentially be a worse year. I think that really needs to be followed, needs to be borne out with data rather than just sort of suspicions. But it is a real concern that if we see an uptick in COVID and we also have a lot of influenza activity, our healthcare facilities could become pretty overburdened again. If we are admitting patients and filling up the facilities for COVID and influenza care, that means we have to defer other types of care. So if anyone hasn't had a flu vaccine and would want to, I think that's a good thing to think about, preventing that burden on healthcare. The other thing that is a concern is if we were to see sort of widespread flu activity and widespread COVID, it'd be real possible for people to have both infections, which could have a much worse outcome than either alone. We are almost finished with our real press for flu vaccinations here at Eastern Kansas. That wraps up tomorrow. But anybody who wants, any of our enrolled veterans who'd like to get a flu vaccine, those walk-in clinics that I mentioned for the COVID vaccine, you can also use those for flu. You'll just want to let the people know when you're there you'd like to get the flu immunization, and they'll have the pharmacy send one up for you. So again, that's Tuesday and Thursday, or Tuesday to Thursday, 8 a.m. to 3 p.m., Building 24 in Topeka, right by the canteen, and in Leavenworth at the old Walmart. We do have one other option for the flu vaccine in the Topeka area. In the Topeka lab from 6:45 a.m. to 9:30 a.m. November 1st through 12th. Monday through Friday, and excluding the Veterans Day, you can walk in and get your flu vaccination there also. So, I think just kind of looking back on where we've been with this, some of you probably know that I'm a psychiatrist, and so that's the clinical service I provide here. And just like all of you, the patients I work with, we needed to be flexible in this pandemic. And so initially, when we were really clamping down, we had to switch to televideo appointments, to telephone appointments. I don't think any of us were early adopters, but we were adopters out of necessity. And so for some of us, we'll keep some of those things going. But, I'm kind of an era where face-to-face is what I prefer. And most of the veterans that I work with are similar or older generation. And, they've all indicated that, yeah, it was nice to have that televideo and we may use that when we need to, but we really like to be able to be face-to-face. So I think applying all of these things that we've talked about to limit this pandemic, to end it quickly, we've got the tools at our disposal to wrap this thing up and to ensure that we're able to continue all of those face-to-face services. I know we'll probably have plexiglass in different places and probably be wearing masks for a little while, but it's good to be able to see all of you here at the facility instead of just on the video camera. So with that, I would like to turn a little time over to Mr. Mooney.
Okay, well, thank you, Dr. Leeson. Good afternoon, everybody. I'm A.J. Mooney. I'm the Assistant Director here at VA Eastern Kansas. I'm currently serving as the Acting Associate Director, or COO. So I joined the VA about a year ago from the private sector, where I was a director of a rural health facility. And apart from the fact that I was born in Topeka, joining VA Eastern Kansas has really been a homecoming for me, as I had served here a number of years ago as the Administrative Officer for Behavioral Health, and I had completed a postgraduate fellowship here after my time at University of Kansas. But more than that, I think coming back to the VA is a homecoming for me because I'm a veteran. As a retired U.S. Marine, I get the opportunity to see and serve fellow veterans every single day, and so I really enjoy that. That's the best part of my job, is our mission, that I get to serve my fellow veterans and continue to serve after my military time has ended. But for today, I wanted to talk briefly about our COVID response in terms of what we're doing for screening and visitors and masking and just other ways we're keeping everybody as safe as we can as we give that needed care. So for screening, we are still screening all patients, caregivers, visitors, vendors, and contractors at our building entrances. Screening consists of a temperature reading and answering a number of questions like, do you have a fever? Do you have new or worsening cough? Have you been in close contact with somebody lab diagnosed? Are you awaiting a result yourself? If you do have a high temperature or you answer yes to any of those questions, our screeners are gonna work with you to provide a nurse triage number and some other options, and maybe some of those options like telehealth, like Dr. Leeson had mentioned. Otherwise, if you make it through screening, you're going to get a color-coded sticker for that day with a date on it showing that you've been screened. And our staff, we have a different process for our staff screening that involves some attestation and things like that. But everybody does need to screen. So masking, we're requiring masks, of course. Our screeners are making sure everyone who enters is masked, or at a minimum have that face shield given certain medical conditions. We do have masks available if one is needed. We've got them there at our screening stations. And we're asking that everyone remain masked while they're here, with some obvious exceptions like seated at a dining area and that sort of thing. Again, I know, like Dr. Leeson said, I know we're going into our second year now of the pandemic, and it's been tough. And masks are tedious. But again, the science is there. We know that COVID spread can still occur in the vaccinated. And we're really all in this together. My mask protects you. You wear a mask to protect me, and we wear masks together to protect everybody that we're in contact with. So, again, we're in this together, and we know that we can beat this thing as we move forward. So for visitors, entry is still restricted to veteran patients with appointments only. We're not allowing visitors unless it's cleared by a provider. We are asking that veterans enter on their own unless a companion is required for medical reason. If a companion is required, we're asking that one is allowed. And we still prefer no one under the age of 18 allowed here, as your visitor. But again, clear those through your provider and make that call before you come up. Of course, our emergency room is available 24/7 for non-scheduled emergency care and behavioral health crises. And the last thing I'll talk about is a group we call the New Normal group. This is a team here at Eastern Kansas that meets every other Monday, and we discuss our current COVID responses and processes. And this group makes decisions in most cases or makes recommendations to leadership for changes or adjustments to what we're doing in our COVID response. This team's multidisciplined. It's got representation across service lines, and it's the intent of the team to be clinically minded, data-driven, and really evidence-based in anything that we do when we make adjustments. And we're following some of the data that Dr. Leeson cited earlier. We follow that pretty closely, and we start every meeting with that data in mind. And really, anyone in the health system can submit topics or agenda items for that group to review of any concerns that come up. And so we will continue to review our processes and what we're doing during the pandemic to ensure we keep delivering care in a safe manner during the pandemic. And with that, I'll turn it back over to Mr. Clofer. We can open it up for questions.
Great. Thank you, Dr. Lisa and Mr. Mooney, for your good information that's important for us all to be able to understand. I want to let you know that you are significant and you are important. We have a trust value score of about 90% from our veterans. We see that is an opportunity for us, that there are some who don't feel that you're important or significant to us. So please come back, give us the opportunity, give us your feedback so that we can improve that care to you. Put questions as you have in the Facebook Live comments there that we can answer them. If we don't answer them now, we'll get to them as well. But I want you to let you know that we appreciate you. Our mission is to serve you, and that's what we do every single day. And so once again, thanks for joining us today, and we wish you the best, and most importantly, as Veterans Day comes, for everyone to remember our veterans, but every day is Veterans Day here at Eastern Kansas. Thank you very much.